If you're over 60 and you take a small white pill every morning for your arthritis pain, I need you to listen very carefully for the next 20 minutes. Because that pill, the one your doctor hands you refill after refill, the one that sits right next to your coffee cup, may be quietly damaging your stomach, straining your kidneys, and raising your risk of a heart attack. And here's the part that breaks my heart as a physician. The pain you've been trying to manage for years, it often comes back. Sometimes worse. And most people never understand why. My name is Dr. Ethan Carter. For more than 2 decades, I've sat across from men and women just like you. Good people, trying to stay active, trying to enjoy their grandchildren, trying to simply get out of bed without their knees screaming. And today, I'm going to tell you 3 things. First, the exact medication I'm talking about. Second, 3 warning signs that it may already be hurting you. And third, what very few doctors will say out loud in a rushed 15-minute appointment. Please, do not stop any medication after watching this video. Watch to the end, then bring what you've learned to your own physician. Let's begin. I've spent my career in geriatric and internal medicine, caring for thousands of patients over the age of 60. I've written prescriptions. I've filled out the same drug forms most of you have seen. And for the first half of my career, I followed the same script every other doctor followed. Then I met Margaret. Margaret was 68 years old, a retired school teacher. She came into my clinic every few months for the same complaint: sore knees, aching hips. I did what any doctor does. I prescribed a common anti-inflammatory pill. She took it every day for 7 years. One morning, her daughter called an ambulance because Margaret couldn't stand up. She was pale, weak. It turned out she had been bleeding slowly inside her stomach for months, and she had no idea. Her hemoglobin was dangerously low. She spent 11 days in the hospital. That was the moment I stopped prescribing on autopilot. And it's the reason I'm sitting here in front of this camera today. I'm not anti-medication. I'm anti-blind prescribing, especially for the people I love most, my senior patients. So let's name it. The class of medication I'm talking about is called NSAIDs, non-steroidal anti-inflammatory drugs. You probably know the brand and generic names already: ibuprofen, naproxen, diclofenac, celecoxib, meloxicam. Some are over-the-counter. Some are by prescription. All of them work in a very similar way. Now, why do doctors reach for these so quickly? 3 reasons. They're cheap, sometimes just pennies per pill. They work fast. You feel relief within an hour. And they're everywhere. Every pharmacy, every drugstore, every kitchen cabinet in America. For a busy physician with 15 minutes to help an aching patient, it is the path of least resistance. Here's how NSAIDs actually work, in simple terms. Your body has an enzyme. Think of it as a tiny chemical switch called COX. When you have joint inflammation, this switch sends out pain and swelling signals. NSAIDs flip the switch off. The inflammation goes down, the pain fades, you feel better. So far, so good. But here's the problem nobody explains. You actually have 2 kinds of these switches. COX-2, which handles the pain and swelling, and COX-1, which does something completely different. COX-1 is your body's protector. It maintains the lining of your stomach so acid doesn't burn through it. It keeps blood flowing to your kidneys. It helps your blood clot properly. Most NSAIDs don't know the difference. They flip both switches off, day after day, year after year. And when you're 65, 70, 75 years old, your stomach lining is already thinner. Your kidneys already work harder. Your cardiovascular system is already more vulnerable. You are not a 25-year-old taking an Advil after a soccer game. Your body responds very differently. Let me give you a number that stopped me cold the first time I read it. According to data published in major medical journals, complications from NSAID use are linked to roughly 16,000 deaths in the United States every year. 16,000. And the overwhelming majority of those deaths are in people over the age of 60. That is not a side effect printed in tiny letters. That is a serious public health issue that deserves a full conversation between you and your doctor, not a quick refill at the pharmacy counter. The first problem is the one most people recognize but still underestimate. NSAIDs irritate and erode the lining of your stomach and small intestine. This doesn't always feel like heartburn. In fact, that's what makes it so dangerous. Many seniors develop what we call silent ulcers, small bleeding sores that produce no burning, no obvious pain. You don't feel a thing. But every day, a tiny amount of blood is seeping into your digestive tract. Over months, that blood loss leads to chronic anemia. Over years, it can lead to a crisis like the one Margaret experienced. Here are 3 warning signs I want every one of you to know. Write them down. First, dark, tarry, or black-looking stools. That is old blood, and it is a medical emergency. Second, unexplained fatigue. Feeling wiped out after a simple grocery run, or needing a nap every afternoon when that's not normal for you. Third, getting dizzy or lightheaded when you stand up quickly. That can be a sign your blood count has dropped. If any of those sound familiar, please call your doctor this week. The second problem is one I almost never hear patients bring up because nobody told them about it. Your kidneys are 2 small organs that filter your blood about every 30 minutes. They depend on steady blood flow. NSAIDs, especially when taken daily, reduce that blood flow. And when you're over 60, or you have high blood pressure, or diabetes, or you're on a blood pressure medication, that reduction can push your kidneys into real trouble. Let me tell you about John. He was 72 when he came to see me. Former electrician, strong man. He'd been taking an over-the-counter anti-inflammatory every single morning for what he assumed was just a bad lower back. He thought nothing of it. After all, he bought it at the grocery store. When we finally checked his kidney function, his numbers had quietly slipped into stage 3 kidney disease. He was stunned. His regular doctor had never once ordered a kidney blood test in 5 years. Here's the truth. An over-the-counter label does not mean safe for seniors to take every day. It means available without a prescription. Those are 2 very different things. And now we come to the one that still, to this day, shocks most of my patients. Back in 2015, the FDA strengthened what's called a black box warning, the strongest warning the agency can issue on almost all NSAIDs. The warning makes it very clear that these drugs can increase the risk of heart attack and stroke, even in people who have no prior heart disease, and sometimes within the first weeks of use. Studies have shown that regular NSAID use can raise cardiovascular risk by anywhere from 20% to over 50%, depending on the drug, the dose, and the duration. And again, this risk climbs as you age. Think about the cruel irony. You take a pill for your sore knees, hoping to stay active, hoping to walk with your grandchildren. And that same pill may be slowly raising the odds of the very thing that ends an independent life for so many seniors: a heart attack or a stroke. I'm not telling you this to frighten you. I'm telling you because in 20 years of practice, I've watched too many families discover this warning for the first time in a hospital waiting room. You deserve to hear it now, while you still have time to make a different choice. Now, let me answer the question that probably brought you to this video in the first place. Dr. Carter, I've been on this pill for years. Why does my pain keep coming back? Why does it feel like I need stronger doses to get the same relief? There are two reasons, and understanding them may change how you think about every prescription you've ever been handed. The first reason is something we call medication overuse. Your body is remarkably adaptive. When you give it the same chemical day after day, it adjusts. Receptors change. Nerve sensitivity changes. Over time, the same dose simply doesn't do the same job. So you take a little more, and a little more, and the pain chases you up the ladder. This is not you being weak or imagining things. This is basic human biology. The second reason is the one nobody wants to talk about. NSAIDs mask pain, but they do not repair joints. In fact, some research suggests that long-term NSAID use may actually interfere with the body's ability to build cartilage, the cushion inside your joints. These medications can reduce the production of certain proteins your body needs to maintain that cushion. So while you feel less pain in the short term, the underlying joint surface may be wearing down faster than it otherwise would. Let me give you a simple picture that my patients always remember. Imagine you're at home and the smoke alarm starts going off in the kitchen. What's the right thing to do? Find the fire, put it out, ventilate the room. Now imagine instead you pull a chair over, reach up, and rip the battery out of the smoke alarm. The noise stops. You feel calmer. But the fire is still burning. And now you can't even hear it. That is exactly what happens when we treat arthritis pain with daily NSAIDs and nothing else. We silence the alarm. The fire, the wear and tear inside your joints, keeps burning. And one day, the damage is far beyond what a pill could have addressed in the first place. This is why, in my clinic, I stopped asking patients, "Is your pain under control?" Instead, I started asking something different. Are your joints getting stronger? Are you moving better this year than last year? Are you doing things you couldn't do 6 months ago? Those are completely different questions, and they point to completely different treatments. I want to give you something practical, something you can use the next time you see your physician. 4 questions. Memorize them, write them on a sticky note, or print this page. These 4 questions can change the entire direction of your care. Question number 1. Do I truly need to take this medication every single day, or only during flare-ups? This is a powerful question because many arthritis medications were never meant for permanent daily use. They were designed for short bursts during painful episodes. Asking this question out loud invites your doctor to pause and reconsider the plan. Question number 2. When was the last time my kidney function and my liver function were tested? If you've been on an NSAID for more than 6 months without a recent blood panel, what we call a BMP or CMP, that needs to be corrected immediately. A simple blood test can catch trouble early. Insist on it. Question number 3. What is the lowest effective dose for me? Many seniors are still on the same dose they were prescribed at age 50, even though their body has changed. Lowering the dose, or spacing it out, can dramatically reduce your risk while still providing real benefit. Question number 4. This is the most important one. What non-drug treatments could I try first or use alongside my medication? Because here's the truth. Almost every major medical guideline for arthritis in seniors lists non-drug treatments as the first line of care. Not the pill. The pill is supposed to be a helper, not the hero. Now, I want to be fair to my fellow physicians for a moment. Most doctors are not being careless. They are trapped in a system. In the United States, the average primary care visit is about 15 minutes. In that time, your doctor has to hear your story, examine you, update your chart, order tests, answer your questions, and write your prescriptions. It is simply not enough time to have a real conversation about long-term joint health. The system rewards fast answers. A prescription is a fast answer. A thorough discussion about exercise, nutrition, physical therapy, and gradual medication reduction. That takes 30 or 40 minutes. Nobody gets reimbursed for that conversation the way they should. So I'm not asking you to blame your doctor. I'm asking you to advocate for yourself. Come to your next appointment with those 4 questions written down. Hand the list to your doctor if you need to. Say, I saw a video that raised some concerns. I'd like to go through these with you. A good physician will welcome that. And frankly, if your doctor is annoyed or dismissive when you ask smart questions about your own body, that may be a sign it's time to find a new doctor. On-screen disclaimer. These are general educational suggestions. Always discuss changes with your physician before starting or stopping any treatment. Now to the part most of you have been waiting for. If that little pill isn't the long-term answer, what is? I'm going to walk you through 6 categories. None of them are magic. All of them are supported by good evidence. And most of them, together, can reduce arthritis pain more than any single pill ever will. First, movement. I know. When your joints hurt, the last thing you want to do is move them. But for arthritis, motion is medicine. Gentle, consistent movement, walking, swimming, cycling on a stationary bike, Tai Chi, lubricates the joints and strengthens the muscles that support them. Research has shown that about 150 minutes of low-impact movement per week can reduce arthritis pain by up to 40% in many seniors. That's roughly 20 minutes a day. Start with 5 if you have to. Build slowly. Second, weight. This one is hard for some of us to hear, but I have to be honest with you. Every single pound you carry puts about 4 pounds of pressure on your knees when you walk. So losing just 10 pounds takes about 40 pounds of force off your knees every time you take a step. 40 pounds. That is not a small change. That is a different life. Third, food as anti-inflammation. We now know that chronic inflammation is at the root of many types of arthritis. What you put on your plate matters. Fatty fish like salmon, sardines, and mackerel are rich in omega-3s, which calm inflammation. Dark leafy greens, berries, olive oil, nuts, and spices like turmeric and ginger all help. On the other side of the plate, reduce sugar, reduce processed foods, reduce excessive red meat. You don't have to be perfect, you just have to move in the right direction. Fourth, physical therapy. A skilled physical therapist can do in 10 sessions what a pill often cannot do in 10 years. Actually strengthen the structures around the joint. Medicare covers it. Most insurance plans cover it. And most seniors never ask for a referral. Fifth, science-backed supplements and supportive therapies. The evidence on glucosamine and chondroitin is mixed. Some studies show benefit, others don't. But many of my patients report real improvement, and the safety profile is very good for most seniors. Please check with your doctor, especially if you're on blood thinners. Heat and cold therapy. A warm bath in the morning, an ice pack in the evening, are free, safe, and surprisingly effective. And mindfulness-based pain programs are not hippie nonsense. They are supported by major pain research centers. Sixth, and this is important, I am not telling you to throw your NSAIDs in the trash. There is absolutely a place for these medications. Short flare-ups, specific injuries, under careful supervision with regular blood work at the lowest effective dose for the shortest possible time. That is smart medicine. Daily, indefinite, unsupervised use, that is what I'm asking you to reconsider. Let me tell you how Margaret's story ended. Because it doesn't end in a hospital bed. After her recovery, we sat down together for a real conversation. Not 15 minutes, an hour. We reduced her NSAID to flare-ups only, not daily use. We sent her to a physical therapist twice a week for 2 months. Her daughter helped her shop differently, more salmon, more vegetables, fewer frozen meals. She started walking her neighbor's small dog around the block each morning, 10 minutes at first, then 20. 6 months later, Margaret came into my clinic smiling. Her hemoglobin was back in the normal range. Her kidney function had stabilized. Her sleep was better. Her knees still ached some days. Arthritis doesn't disappear. But on a scale of 1 to 10, her pain had dropped from a 7 to a 3, without a daily pill. And she said something I'll never forget. She said, "Doctor, I spent 7 years trying to turn off a warning light. I wish someone had told me I could actually fix what was wrong." I want you to hear this clearly. Getting older does not mean you have to live in pain. Getting older does not mean you have to be on a handful of pills just to function. The aches in your joints are a signal, and that signal is asking for something more than suppression. It is asking for movement, for nourishment, for patience, and for a care team that sees you as a whole person, not a prescription number. You have more power over your arthritis than the last 25 years of television commercials have led you to believe. So let me tie it all together. 3 things to remember. 1. The common arthritis pill, the NSAID, can damage your gut, your kidneys, and your heart, especially after 60. 2. It often masks pain while the underlying joint continues to wear down, which is why your pain may be getting worse. 3. You have real, proven, safer options. Movement, weight management, anti-inflammatory nutrition, physical therapy, and more that can dramatically improve how you feel. Now, please, do not stop your medication today. That is not the message. The message is this: pick up the phone this week. Schedule an appointment with your doctor. Bring the 4 questions I gave you. Ask for a blood panel if you haven't had one recently. And begin, even in a small way, to add one of those safer options to your routine. If this video helped you, do me a favor. Leave a comment below and tell me, how old are you and what medication have you been taking? I read every single comment, and what you share helps me choose the topics I cover next. Subscribe to this channel and tap the bell because next week I'm releasing 5 foods I recommend to every arthritis patient in my practice. You won't want to miss it. You deserve golden years that are not ruled by a pill bottle. You deserve to move, to travel, to dance at your grandchild's wedding, and to feel like yourself again. I'll see you next week. Take care of yourself.